For those who use their hands often, such as gardeners or carpenters, overuse may cause tendon-related injuries that might require medical treatment. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Edward Chan, an orthopedic hand surgeon at Queen's Medical Center, West Oahu. Aloha, Dr. Chan. Thanks for joining us this morning.
Aloha. Thanks for having me.
We'll jump right into it. What are some of the most common tendon-related problems in the hand and wrist?
So tendons are the structures in the body that connect the muscles to the bones and allow for movement. So the most common tendon problem in the hand we see is called trigger finger or trigger thumb. This affects the tendons that allow you to flex the fingers and the thumb down. And the most common tendon problem in the wrist is called the Quervain's tendinosynovitis. And this involves the tendons at the radial side, we call it, on this side of the wrist. And so usually leading to pain and inflammation.
Wow, what are some of the symptoms of these two conditions?
So for trigger finger and trigger thumb, people usually experience pain and stiffness when trying to flex the digits down. Oftentimes the digits can get stuck in flexion and have a hard time going straight again. And sometimes people have to use their other hand to straighten it. And then for the de Quervain's tendinosynovitis in the wrist, usually the symptoms are pain, again, on this radial side of the wrist, especially with movement and activities.
Wow. Now, what are the treatment options for these two conditions then, for people who may be struggling with some of this?
Yeah, so thankfully, both of these conditions are very treatable. For very mild cases, one can consider trying splinting or bracing or simple anti-inflammatory medications. But the reality is, for a lot of people, these don't provide they don't provide long-lasting relief. So by the time a lot of patients come and see me, usually we're recommending a steroid injection as the most effective treatment, and that can work very well. If symptoms persist or recur after a couple of steroid injections, then we usually do a simple surgery for definitive treatment. Now, these surgeries are, simple and can be done very efficiently as a same-day procedure, such as at the Queen's Medical Center, West Oahu's new same-day surgery center.
Well, now again, we have those treatment options there on the screen. To learn more about Queen's Orthopedic Surgery Department located at the Queen's Medical Center, West Oahu, you can call 808-691-3520. Thank you so much, Dr. Chan, for chatting with us today. Great information as always.
All right, thanks for having me.